Health doesn't always shout. Sometimes it whispers. And if we don't pay attention, we might miss it. Welcome to Health Unfiltered, a series by Fullerton Health. Here, real people share the moment they choose to pause, check in, and take charge of their health. These are stories of courage, of early detection, and of lives changed not by symptoms, but by a single decision. Because behind every diagnosis is a voice, a family, a future, and a reminder that the best time to act is before it's too late. I'm your host, Veronica, and I invite you to listen, reflect, and be inspired. This is Health Unfiltered. Let's begin. Today, we are diving into the topic that affects not just Singapore, but millions of people around the world: chronic diseases. I'm joined by two special guests who bring both clinical know-how and big-picture perspectives to the table. First up, we have Dr. Marcus Lee, a family physician and a designated workplace doctor. He has a strong background in primary care and occupational health. Joining him is Dr. Roland Xu. Roland has led clinical and strategic initiatives across healthcare and insurance in Asia. In today's conversation, we'll cover everything from prevention and early awareness to family history and risk factors, to the challenges patients face, and of course, practical advice. So let's jump in. Good afternoon, Dr. Marcus, Dr. Roland. Thank you for joining us and welcome. Maybe we start with simple questions. What exactly is chronic diseases, and are there different types of chronic diseases?
Yeah, so chronic disease is an umbrella term. It encompasses a wide range of diseases that affect patients over a long period of time, hence the word chronic. And a lot of people tend to think that it's just limited to diabetes, hypertension, and hyperlipidemia. But really, it encompasses many other conditions also, including asthma, chronic obstructive lung disease, rheumatoid arthritis, and various other even mental health conditions as well.
Okay. Are there differences between early stage chronic diseases and late stage chronic diseases?
Yeah, so all diseases are staged by severity.
Okay.
Right, and of course, the earlier you detect them, the easier it is to treat them.
And is it avoidable, Dr. Roland, for people to avoid chronic diseases by certain lifestyle or habits?
Yes, definitely. I think, to be honest, if you're looking at chronic disease at large, there are, of course, ways that we can help to reduce the risk of chronic diseases. But of course, there are certain part of the population who are inherently more at risk. So for this group of people, what we really want to focus on is how do we help them detect the disease early, and how do we help them prevent complications that might come across from this chronic disease as well.
Many chronic conditions stay silent, right? Start silently. Do you have examples of patients who look perfectly fine just to find out that they actually have chronic disease?
Oh yes, I would say that more often than not, a lot of us, we may not pay good attention to our health. More often than not, you hear patients quoting the fact that they're too busy, right? And a lot of us would like to downplay the issues that we have as well.
Okay.
So, very simple symptoms such as giddiness, fatigue, all of these could be telltale signs of something that is a little bit more sinister, right? So we have seen patients who has gone to the doctors with chronic headaches, chronic giddiness, but when you check their blood pressure, it's really out of sort right from the onset. But to them, they very often attribute it to tiredness and fatigue that they have from their day-to-day, be it at home, be it at work, So a lot of these situations don't get detected and brought to the surface until we really sort of questioned and sort of help the patients realize what is it that actually bothers them. And that's when a lot of these diagnoses of chronic disease do come to light.
Dr. Marcus, do you through your consultation with patients, do you normally see patients who are already in their advanced stage of chronic diseases, then they come and visit the doctor?
Well, unfortunately so. Actually, by the time many chronic diseases are manifest with symptoms, it's usually in a more advanced stage.
Okay.
As a general statement. So some of them, they already present with the symptoms, and worse still, they may even have the complications of it. Like diabetes, it may be complicated by heart disease, heart attack. And many people present at that advanced stage. They have a heart disease, they have heart attack, and then they find out that actually they have underlying diabetes. So unfortunately, it's a bit harder to treat at that stage.
Maybe share with us also in Singapore, right? How many people are diagnosed with chronic diseases, and maybe the population trend or the medical trend of our population?
So we do trend this, every year through self-reported surveys. But in general, if you're talking about the past 17 years or so, the trend is like on the way up. That may not be a bad thing, I wish to emphasize, because it may mean that there is greater awareness about the condition, and people more proactively go for screening, and thus more diseases are detected. Hence the numbers go up.
And do you see a trend in young people being detected earlier?
Yes, because of greater awareness.
Okay.
So I think it's important for people not to be complacent about that age. They shouldn't have the mentality that if I'm below 40 or even below 30, I would not have any risk of chronic disease at all. In fact, due to a more sedentary lifestyle or more indulgent diet, it is possible that people develop chronic diseases even in their 20s or 30s.
And Dr. Roland, do you think the chronic diseases are related to family genetic or family history?
To a certain degree, yes. But of course, we can't 100% attribute it to our heritage as well as family members as well, right? So I think a good example will be the recent MOH update on genetic testing for familial hypercholesterolemia. So familial hypercholesterolemia means that you might have certain genetic subtypes that makes you more prone to have a high cholesterol, which was what Marcus sort of spoke about earlier as well. So you can see that from a ministerial standpoint, they do acknowledge, right, that the genetics do play a part in some of these chronic diseases, and therefore there is actually a need for us to focus on genetic testing for some of these conditions, and so that we can have earlier intervention and better outcomes, right? So that being said, we do see that a lot of times, a lot of these patients may not always have family history as well. Some of them, they come in with high cholesterol, diabetes at an earlier age, but when you ask about family history, they will say totally clean, that there is no family history or whatsoever. So it's really a mixed bag. But to be fair, I would say genetics definitely plays a part, and it is increasingly being recognized by the local authorities, by the local regulatory bodies, and even internationally as well. So I think a lot of these new guidelines that are coming up, they are actually looking at how do we even help patients as well as their families to get tested earlier for some of these genetic mutations, so that we can pick them up early and really, with the aid of certain medical intervention, lower their long-term risk when it comes to chronic disease as well.
And when you talk about family risk, right, family history or genetic, Dr. Marcus, have you seen patients who have family genetic history or family history come to you and say, I don't care, it will not happen to me?
Well, more often than not, what I see are people who are more vigilant because of their family history.
Okay.
Right, I have young teenagers who have come to me before saying that they want to screen for heart disease, and that's because their father just passed away of a heart attack.
Okay.
Right. Of course, we need to be rational about the screening we do, the age of the patient, the profile of the patient. But I think due to increased awareness, better education, people are more aware of the importance of family history in chronic disease.
And maybe tell us a little bit about how people with early stage and late stage diagnosis, the treatment, the difference in the treatment.
Well, it varies from condition to condition, but maybe I can use diabetes as an example.
Okay.
So in very early stage diabetes, you may not even have symptoms. You may just have slightly abnormal blood tests, and you may opt not to treat it with medications, but just lifestyle treatment alone, like exercise, diet modification, and so on. But as the disease progresses, the later it is detected, the more medicines you may need. You may need not just one, but maybe 2 oral medications also. And in certain cases, when it's detected at the advanced stage, you may even need to start with insulin treatment.
Dr. Roland, do you think that it's very hard to help patients in your practice, very hard to help patients change their lifestyle? Because there's this saying, right? Changing lifestyle is harder than taking medication. What are your thoughts?
Well, I guess it really has to do with human behavior, right? So even if you look at chronic disease management programs, or CDMP for short, it's not it's not something novel. It has been in the market for many years, even decades, right? Right from the onset. People have been exploring different ways to really help our patients better manage their condition.
Okay.
But interestingly enough, if you were to go onto the internet and do a quick literature search, you will see that the engagement for such chronic disease management program is really quite dismal. It's generally quoted about 15 to 30%, right? And that in itself speaks volume. And what we do see a lot of times is that patients may not always recognize the importance of managing their chronic disease. And a lot of times, there is always this fallacy, right? When you say that in the absence of any issues, I'm doing well, right? But people don't realize that a lot of these things, a lot of these damage are cumulative. So when you don't take care of your health now, the issues may not even sort of surface until much way later, right? So in a sense, that speaks for why a lot of time for chronic disease management, especially a lot of times when they sort of target behavioral changes, engagement is low. A lot of these habits may not always stick true, and patients at large may not even stick to management, which can be medications as well.
What are some of the challenges that you see amongst patients that they face or they experience while going through their management of their chronic condition?
Well, when compliance is an issue, actually there are many underlying causes, and many of them are psychosocial, meaning it is the particular circumstances, such as at a job. A lot of them may need to work long hours, and when by the time they come home, they are too tired to exercise. They just want to indulge in some good food to relieve their stress. Some of them may work shifts, and then as a result, their meals are irregular, so that impairs the ability to control their medical conditions. Right, and of course, if they work shift hours, it means that they don't have time to eat their medicine regularly, and many of them skip their medicines as a result. You can see it on the blood test when you do it periodically. So that's the challenge, because many of them understand the importance of health. They want to control it, but they are just, for want of a better word, they're trapped in these circumstances, right? Their job situation, their family situation is as such.
So do you think, Dr. Roland, that such challenges poses a lot of stress on the patient, whether it's emotionally, financially, or is it physically?
Definitely. So I think maybe just to add on to what Marcus had mentioned a bit earlier as well. If you were to go to Sing Health's website, you will actually see something called social prescription, right? It's even though it's a terminology that's been used for quite a number of years, I think it's something that's sort of kicking off here in Singapore. Right. And social prescribing really just looks at a patient, not just from a single individual, but what is the social determinants that surround a patient as well. Right. A lot of times we might be a bit hasty to say that, you should do better at this, you should control your disease a bit better, you should be more compliant to your medication. But what we tend to forget is that these are individuals who have a lot of many other social issues that can influence their eventual outcome and control of disease as well. And that's why social prescription is now becoming something that is more prevalent. We are seeing how the individual healthcare clusters here in Singapore are trying to shape how health is being delivered, right? And this sort of speaks volume about how healthcare is not just about the individual, but very much about the social aspect of an individual as well. Coming to the financials part of it, I think more often than not, when we speak to patients, they are always complaining and saying, doctor, medicine is very expensive, right? But I think what they also don't sort of realize is that the cost of chronic disease may not always be measurable in terms of dollars, right? To the individual, there could be the cost of medication, but likewise, there could be other hidden costs as well. There could be cost in terms of impediment from work, right? Having to take sick leave, being able to recover much slower at work because of recovering a lot slower from from acute infections because the chronic disease is not well controlled, right? And likewise, there is also this hidden cost to those around them as well. Say, for example, if a patient has poorly controlled diseases that leads to complications, right? Stroke, ischemic heart disease, to name a few, they might need more frequent visits to the specialists, to the doctors at large.
Yeah.
And a lot of time, we do see that family members will have to take time off from their work to accompany the patients for their follow-up as well.
Okay.
So a lot of these are in fact hidden costs that the patients may not always come to realize, but it's just as important, right? And of course, there is the hidden cost to society at large, where we do see that, if chronic diseases are not well maintained, we see that the cost of healthcare is only going to get higher. Right. And of course, the pet topic for everyone is cost of premiums for insurance and whatnot. All of these are all interlinked. And I think at the back of it, we need to help our patients to better understand what are the costs, the true costs of any form of chronic disease in itself.
So definitely it is much more affordable when you detect early and you get treated early. And what else is the government doing besides community, besides family? What is the government doing to help patients who probably cannot afford or may not be so aware of their conditions?
So if you look at how the proposition, or rather the message that the ministry has been sending out over the past years, they're largely consistent. That chronic disease is in fact an important part of healthcare management. But what we do see is the method of engagement has sort of changed a fair bit over time as well. With the recent launch of Healthier SG, you can see that the ministry is sort of moving towards prevention for one. Second, there is really a push to get general practitioners at large to be better involved in the healthcare of patients, to better manage chronic disease, and also to arm all of us with all the practitioners on the ground to have better knowledge and care pathways so that we can help better manage our patients as well. Right? HPB, for example, has been coming up with many different varieties of health engagement, be it at a corporate workplace. So examples would be things like the WOW program, where they do engage corporate employers to see how they can better or they can empower their employees on the ground to do better, to look after their health, look after their mental health, and all the many different aspects of health as well. Right. Likewise, Fullerton Health has also launched a new program with HPB known as Health Track SG, where we are actually looking at utilizing AI, wearables, as well as other incentives to better manage our patients' chronic disease at large as well. So there are many different types of healthcare interventions that are now being put in place by the ministry to help better support patients with chronic disease as well. And I think what is definitely heartening is that it's becoming more of intersectoral work, right? It's not just, as we are in the past where it's just, for example, Ministry of Health going at it and then the rest sort of are sitting on the sidelines. You're seeing that all of these are coming together and really providing that support that is required.
That's great to know, so that it will help a lot more people, in the corporate world, individuals who have chronic diseases to be able to do their treatment and be, supported by the government and the community. Dr. Marcus, do you think such wearables, apps, technology will help patients to manage their chronic diseases much easier and more effectively?
Yes, definitely there's a role in all this. Firstly, if you talk about telemedicine, it does take the burden of face-to-face clinics in managing people with stable chronic disease. Because what I've seen is people with stable chronic disease, they may forget to take their medicines. Why? Because they have no time to go to the GP to collect their medications. Maybe the GP is too far away, they're too busy. But with telemedicine, they can actually, extend the current supply of medication, provided that the disease is, well controlled, their blood pressure, etc. are well controlled. So it makes things easier for them. And if you talk about wearables and all these other adjuncts, it allows patients to have real-time data on how they are doing, right? In terms of things like their heart rate, number of steps taken, and so on.
They become more aware of their condition, right?
Yeah, that's
and
right.
therefore they become a bit more proactive in taking medication or go for a walk. If let's say certain things are not right.
That's right. I mean, with the correct prompts, the prompt will say, okay,
Yeah.
you need a bit more sleep, you need to walk a bit more. Then they'll be motivated to do all this.
Yeah, like a private doctor next to him telling
Yeah.
him what to do. Yeah. So do you think with all these changes, with all this government's program, it will help patients to be a bit more responsible for their condition?
Yes, it gives them more ownership.
Mm.
But we have to bear in mind some barriers also. The chief one being openness to using such technology.
Yeah.
So for some people may find it a challenge to
Yeah.
manage technology like this, and it's important that we don't leave them behind.
Yeah.
Even though we try to digitize healthcare.
That's a good point, because there are a lot of older generation who are not digitally savvy. They may not be able to use such technology to help them. So the people to people, doctor to patient time has to be given as well to help them with their journey, right?
Definitely.
Yeah. So looking ahead, right, for new patients who are first time diagnosed with chronic diseases, what are the steps that you would recommend the patient to help them through their health journey without overwhelming them? Maybe both of you can give your perspective.
I'll start first. So the first consult is very important.
Yeah.
Right. The first consult when you give the diagnosis.
Yeah.
So you have to bear in mind that you have to tell them the implications of having this condition. It's not just a word that you throw at them.
Yeah.
Right. So if you have high cholesterol, what does it mean?
Yeah.
High cholesterol means that you are at higher risk of, as I mentioned, a stroke, heart attack, and so
Yeah.
on. It's important that you control this earlier. But you have to be mindful not to, what you call information dump and overwhelm the
Yeah.
patient. I mean, that will scare the patient away.
Yeah.
And certainly we do not want to get to the point where we are using like fear-mongering tactics, right? I mean, you have to be objective about the complications of the disease, but you don't want to make them too intimidated as well.
Sure.
And then next we'll be talking to them about, the management of it. And usually we divide it into two broad categories. In a busy clinic, it's easy to focus on the first category, which is medications. I just give you medication for your condition and that's it. But I don't think that's the best way. Actually, we should start with lifestyle management first, diet, exercise, moving around, so on and so forth. So I think it's important to let them know that actually that is more integral than just, giving medications.
What do you say to patients who come and tell you that I will eat durian, I have high cholesterol, I eat durian, after that I take my medication, I should be fine?
So it's important to let patients know that, medications are not like the silver bullets.
Yeah.
They are not the be-all and end-all.
Yeah.
They are not a miracle solution, right? So back to the most fundamental part, it is the lifestyle. I don't think we should get to the point where we force a very ascetic lifestyle on our patients. I mean, that will actually turn them away from following you up. You can tell them that, okay, once in a while, reward yourself, indulge, but do be careful. Okay, durian season, maybe you want to take one durian, 2 durians, as a means of relaxation. I mean, that's fine. But don't forget to control your diet for the rest of the season.
If there is one piece of lasting advice you want to share with individuals who are managing their chronic disease condition, or to prevent or for early detection, what would the advice be, Dr. Marcus?
Well, the good old adage, prevention is better than cure.
Yeah.
And it's always easier to manage something at an earlier stage.
Okay, that's true. Dr. Roland, if your audience, you want to leave impression with the audience, what is that one piece of advice you would give them?
Well,
takeaway.
We'll say that it's really the point about sort of to echo where Dr. Marcus is coming from. Prevention is better than cure, but also to really think about not just how chronic disease can potentially impact you, but also your family members and your loved ones as well.
Yeah.
Right? I think a lot of times when we tend to look at chronic disease or any form of disease at large, we are always sort of thinking about how this would fundamentally change the way I live, the way I behave. But likewise, it's also important for us to consider those around us, our loved ones. And that's the reason why prevention is better than cure, right? End of the day, it is not a death sentence. We do want patients to take ownership of their own health and really collaborate and work in partnership with the doctors.
So the message is to the audience is, take care of yourself before you can take care of your loved ones.
Yes,
right?
yes,
Definitely.
So thank you very much, Dr. Marcus. Thank you very much, Dr. Roland, for joining us. It's been a pleasure.
Thank you.
Pleasure.
Chronic diseases are reality for so many people. But as we've heard, prevention, awareness, family support, and even small lifestyle changes can make a huge difference. And to you, our viewers, thanks for joining us. We hope this conversation inspires you to take the next step for your own health, whether it's booking a checkup or simply supporting someone close to you. This has been Health Unfiltered. Thanks for tuning in.